Alright, YouTube. It's been a minute. The semester caught up to me, so I've been busy. But I'm back. So, this video cover low back pain and why you have it and what you can do to fix it. So, first thing to talk about is the anatomy. So, low back right here, right? The opposite, the abs. So when talking about the low back, you'll say the agonist or the main muscle, the back. What do these muscles here, they're called the erectors, what do? They do this or this, right? What do the abs do? They do this. See my spine? That's what they do. And this. So they make the pelvis come that way, right? So low back pain, the reason why you have it, you have really tight low back muscles, erector muscles, and then you have really weak glutes, hamstrings, and abs. And they're also constantly lengthened. So right now, my abs, when this is normal, right? When I'm like this. So when my pelvis, watch my pelvis, when it's like that, these muscles here, they come lengthened. These muscles here, hamstrings, lengthened. And a really, really long muscle is a really, really weak muscle. So what do you do to fix this? So start with the glutes, probably the easiest ones to fix. You're going to do hip thrusts. So yes, even for all the guys out there, do the hip thrust. It's good. Strong butt, strong squat, strong deadlift. You need it. Another good thing to do is you can get one of those elastic bands, rubber bands, or one of those booty bands. You can put it around your knees, about right up here, right by your patella. And you can squat. And while you're squatting, warming up at least, you can have it around there and actively push your knees out, try and resist. That'll help activate the glutes. Because what do the glutes do to this? That's what they do. Another thing, you can do the low bar squat. So, high bar, right? You're here. You're like that. Low bar, you kind of lean forward like that. And you sit down more. And what it does, it utilizes your posterior chain or the backside muscles a lot more. So, and also it gets rid of knee pain, but it utilizes your glutes a lot more. So if you have to, switch to low bar. It's okay. Another huge thing that I see with a lot of clients when they're squatting and deadlifting is when they're squatting, they're like this. That's a no-no. So you don't want to squat and be like this, right? You want to squeeze your butt at the top. Squeeze the butt like you're trying to hold in some poop or something. Or like you got to fart and you just got to squeeze, hold it in, okay? Squeeze your butt. Work it. Next, the hamstrings, right? So, the hamstrings, what do? Hamstrings, right here. Glutes, hams. Hamstrings do this. They flex the knee. You might be able to see it. These are kind of tight pants, but hamstring contract right there. So, when your glutes, when your low back is tight and you have that anterior pelvic tilt, so where your pelvis is like this, your hamstrings are long, they're lengthened, right? That means that they're not being worked or contracted very often. And also daily life, we don't really use our hamstrings a lot. We use quads more. So strengthen the hamstrings, do your stiff leg deadlifts, Romanian deads with dumbbells. You can also do a leg curl. You literally just sit in a machine and you're just like this. you can like text on your phone. You can be like, yep, all day, do those. And then you can see on my Instagram, but at George Landry, by the way, I posted the Nordic the Nordic leg curl. That's hard. Do the RDLs, get more advanced, get stronger hamstrings. Then you can do the Nordics. That's stage 3. So, lastly, and this is the most important too, so your abs. Abs are really, really weak. Like, all the time, clients, when they have the low back pain, they have really, really weak abs. Like, really weak. So, like this, right? Pelvis here, neutral. When my pelvis is like this, what happens? My abs are lengthened. Okay? They're not at normal length, so they're lengthened. A long muscle is not a strong muscle. Okay? Get that in your head. Long muscle, weak muscle. So, when your abs are lengthened like that, they're not going to be very strong. So, what do? We're going to do a lot of things. But, so the deepest layer of the abdominals is the transverse abdominis. That is like way in here, okay? You would have to cut me open to see it. What are you going to do to strengthen that? Well, you're going to do stomach vacuums every day, every single day, okay? I'm going to make a video on that, on why everyone should do them, but that's next time. So stomach vacuum, what are you going to do? Right here. I'm going to blow all my air out and then suck my stomach in as hard as I can. What's that doing? That's making your transverse abdominis contract really, really freaking hard. Try and hold it for 10 seconds. You won't be able to. So when you do those, first thing in the morning, every morning, wake up, don't have any water yet, go pee, do your vacuums, 3 rounds, as long as you can. Been doing them for months. I'll make a video on the benefits. Another thing, transverse abdominis. Learn to breathe and brace. So many freaking people, so many clients, they just like when they're squatting, they're like this. They're like when they're squatting, right? That's wrong. So breathing and bracing. I'm going to breathe through my diaphragm, stick my gut out, right? And then I'm gonna flex my abs as hard as I can when my stomach is out. What's that going to do? That's going to create a strong core. It's going to contract the TVA, transverse abdominis. It's going to make sure that when you're squatting 300 pounds, you're not going to do this and kill your back. That's TVA. Next, rectus abdominis. So the 6-pack that everyone wants, all these right here. You're going to do a reverse crunch. That's the most basic ab exercise in the world. All of my clients can do it. You just lay on the floor. You bring your knees up. That's easy. Every single client, even if they can't feel their abs and all these stupid exercises that other trainers have, they feel their abs in these. Reverse crunches. Do them every day. After a couple weeks, you should be able to do a plank. And then when you're doing a plank, then afterwards you can start adding weight, 10, 20, 25, 45. Hold it for 30 seconds. You're going to contract your abs as hard as possible. As hard as possible. Then afterwards, so a tip with the plank is a lot of people, like, they have that pelvic tilt where they're like this. And they're relying too much. They're putting all the pressure way, like the leverage and moment arm and all that crap. They're putting too much pressure on their toes. Put the pressure on your abs in the plank. Doesn't matter if you can only hold it for 10 seconds. Next time, you can get 15, and then 20, and then 30, and then we can put weight on. That's how you do that, okay? Then you can also start doing cable crunches. Cable crunches are easy. And then you can work up to leg raises. So you can be in that little chair thing at the gym where you're here and you have the back support. You can do your little leg raises, okay? Great, you've got to 12, 3 sets of 12. Now, put a weight between your legs. Do 3 sets of 12 with 5 pounds, then 10, then 15, 20, and then move to a pull-up bar. Hang with no back support, stabilize yourself, and then do the leg raises. Do the same thing where you work up with weight. Strong abs. Stop doing these stupid freaking Russian twists with a medicine ball and sit-ups, okay? That's not going to create strong abs. Barbell movements, breathing and bracing properly, and strength movements like the plank with added weight. That's strong abs. And then for your obliques for the freaks, right? You can just get on a cable. You can twist on a cable, medium, high to low, low to high. What's the difference in all of them? Well, medium, you're going to get right here. High to low, you're going to go here, like that. You're going to get your upper oblique muscles. Low to high, which is the hardest, you're down here. Twist up. Big surprise. The V-line that everyone wants. So, to summarize, tight low back, weak abs, weak hamstrings, weak glutes. Fix all of them. Get strong.